I actually started working with dengue virus and just really enjoyed all the techniques involved in the lab work and really enjoyed asking a question and answering it with experiments and then finding out that you had probably 3 or 4 questions that came from that. So for 18 years I've looked at mosquito-borne viruses, so dengue and Ross River, particularly in the Southeast Asian region, and I work with Associate Professor David Wiley, and we look at STIs and also antimicrobial resistance markers. Trying to keep track of the pathogens that infect us and trying to keep on top of the resistance to the current methods of treatment that we have. Because if you overuse some sort of antibiotics that aren't actually effective, then the bugs can actually build resistance to those. So we also want to identify the individual person's bug to see what markers they have, and then keep an eye on the bugs that we do see and detect and make sure that they haven't changed too much so that we're not having to look for alternate treatments. Well, as everybody knows, we were all in some pretty strict lockdowns last year. We had mask wearing, we had hand washing, and as well now we have the rollout with the vaccine. But all of this actually changed the other viruses that were transmitting last year. So we saw an absolute decimation of influenza, which was wonderful. We saw an increase in probably 2 different viruses, so rhinoviruses, which is a really common cold. We actually saw an increase in that, and that we think is because the rhinoviruses are slightly different and they are resistant to alcohol. So if you're washing your hands, things like that, it didn't actually stop transmission of those viruses. And something I'm also really interested in is, beginning of this year, we saw a really early outbreak of respiratory syncytial virus, which is another respiratory virus that really infects children from about 10 years and under. It can be quite devastating. So something I want to do is look at RSV and also rhinovirus and see if they've actually changed quite a bit from earlier years before all of these preventative measures came into place and changed the dynamics of how we transmit viruses.